My name is Dr. Melissa Chiang. I'm a board-certified dermatologist and dermatopathologist. I've been practicing in the Houston area for over 10 years. My approach to dermatology, I think, really concentrates on the patient. So the first thing, even though dermatology is a really visual field, the first thing that I like to do is to listen to the patient and find out what their concerns are and what brought them in. And then the second thing is looking really carefully, because I think sometimes we as dermatologists feel like we can get the answer from the door. But I always like to take a really good look at the patient. And then the third part is the education. So the patient needs to know, what is the diagnosis? Am I certain of the diagnosis, or is there uncertainty? And then the next is education about how we're gonna treat and what they can expect. Sometimes I get the question of, am I ready to see a dermatologist? And that's actually a really hard question to answer uniformly, but the way I think about the skin is there's two different types of conditions. One is like inflammation, so rashes, acne, rosacea, and the other is growths. In terms of the rash category, if you have a rash that's not resolving, you should go see a dermatologist. There are lots of people that go see a lot of other kinds of doctors first, and you can waste a lot of time that way. So I would say, if you want the expert for your skin condition, you're gonna see a dermatologist. I think dermatology and aesthetics really dovetail. And the reason why is because dermatologists specialize in skin and hair, right? And that's the first thing that we see when we look at each other. Someone who has beautiful skin, even if their features are average, they're gonna be above average because of their skin. So the dermatologists specialize in the skin, and I think aesthetics is all about how our appearance is, whether it's on the surface, whether it's the contour and support, texture of the skin. So I almost feel like you can't have aesthetics without the dermatology component. The dermatology services that we offer are consultations, and they can be for any kind of skin issue, any kind of hair issue, and any kind of nail issue. I see patients that are from their newborn, from months old, to in their 90s. I think my oldest patient is 96 years old.